Well, hey guys, good morning. My morning has been off to a rocky start. I just dropped all over the floor 32 ounces of Natural Calm. That's that magnesium drink that I shake up in the 32-ounce water bottle and drink in the morning. I just spilled that all over the floor. So, not naturally calming whatsoever. So I'm recuperating with a little Bustelo and some adaptogen blend from Four Sigmatics. But speaking of naturally calming things, today's video I'm going to cover a topic that I get questions regarding all the time, and that is sulfur. And sulfur in skincare. Sulfur is an ingredient that you've probably heard a lot about as being helpful for a variety of skin conditions, allowing for clear skin, glowing skin, great radiant skin. So today I'm going to talk about sulfur. It is an ingredient in skincare products that I like and can be incredibly helpful for a variety of things, and is often prescribed in combination with other topicals for a variety of diseases in dermatology. But in today's video, I'm going to first tell you guys what exactly sulfur does in the skin, how it works. I will cover the skin issues and conditions that topical sulfur is helpful for. I will talk a little bit about how it goes to work and kind of the time course of its action in the skin. I think that's something that's helpful to be aware of when you use a new topical ingredient. And I will conclude the video by sharing with you guys some over-the-counter sulfur-containing topicals that I'm a fan of and that are hopefully readily available to you guys. Topical sulfur in dermatology is a treatment for acne, for rosacea. It is also a mainstay treatment of seborrheic dermatitis, also known as dandruff when it occurs on the scalp, seborrheic dermatitis on the face. Many of you verbalize in the comments that you suffer with a condition that you describe as fungal acne, which I equate to an overgrowth or a abnormal inflammatory response to Malassezia or Pityrosporum yeast that naturally lives on everyone's skin. And sulfur is an effective treatment for that concern. Sulfur is also effective for perioral dermatitis, something that I know many of you cope with and deal with out there. And it also, some less common things that you may be familiar with, but that we see in dermatology all the time. They're not uncommon, actually they're very common. Scabies, a topical sulfur is used for, and warts. It's also helpful for treating warts. So it is a jack of all trades in the skin. How does it work? What are its properties? Sulfur is what's called a keratolytic, meaning that it softens and dissolves those compact layers of dead cells on the top layer of their skin, the stratum corneum. It helps to break that up, so that compact layer of dull, dead skin can build up in people with acne and result in closed comedones, plugged up pores. It can result in some of the scaliness of seborrheic dermatitis, and sulfur is helpful in that situation. It specifically works to do this by interacting with one of the amino acids in the protein keratin called cysteine. Topical sulfur is also an antifungal agent, which is why it is helpful for seborrheic dermatitis, dandruff, as well as tinea versicolor or Malassezia furfur, and Pityrosporum folliculitis or fungal acne. These conditions are helped probably because it is an antifungal. These conditions are all related to a little yeast that lives on the skin called Malassezia furfur. And this little yeast, people's immune responses to it can be aberrant, and they, as a result, have conditions like seborrheic dermatitis. So topical sulfur specifically goes targets this little guy by virtue of the fact that the bacteria that normally live on our skin will interact with sulfur and make something called pentathionic acid. And pentathionic acid in combination with sulfur's keratolytic effect are not so conducive to fungal growth and help to keep that fungus in check. Furthermore, sulfur is also antibacterial. It has been shown in vitro to have an inhibitory effect on the growth of Propionibacterium acnes, or Cutibacterium acnes as he's been renamed. This is a bacteria that plays a contributory role in acne pathogenesis. Also, the other bacteria that sulfur can inhibit the growth of include certain species of streptococci as well as Staphylococcus aureus. So antibacterial, antifungal, keratolytic, and then fourthly, it also has antiparasitic properties. There are various parasitic diseases in dermatology that are treated with topical sulfur. I already mentioned scabies at the beginning of this video, but we have a little sort of a parasite, an ectoparasite it's called, Demodex. It is a mite that lives on everyone's skin and is otherwise benign, not something that needs to be eradicated or really can be completely eradicated, or should you go worrying about it. However, in people with inflammatory rashes on the face, like rosacea, it is thought that those individuals have kind of an abnormal, overly robust immune response to the little Demodex mites that live on our skin, and that contributes to their disease. And so topical sulfur is helpful in those conditions, probably because it reduces the burden of Demodex mites. If you are at all curious about Demodex mites and rosacea, check out my video on cilantro. I go into detail there as well. So if that is you and you're curious about it, make sure you check that video out. But 4 properties of topical sulfur make it a wonderful treatment for a variety of things. There are a variety of forms of topical sulfur. First form that comes to mind is something called sublimed sulfur, and this is formed by the direct conversion of crude sulfur from a solid to a gas. That gas is then condensed into a fine yellow powder, sulfur powder. Another form of topical sulfur, and probably the one that I am most familiar with as a dermatologist, and what is in the majority of prescription and over-the-counter sulfur treatments, is precipitated sulfur. And this is different from sublimed sulfur in that the particles of sulfur are much finer, they're much tinier, they're much smaller. And that's great because the smaller the particles of the sulfur, the more skin surface area the sulfur can go to work on. So it results in a greater treatment outcome. Then a third type of topical sulfur, one that is not as frequently encountered in over-the-counter products and not typically used, but is available, is colloidal sulfur, and that is even smaller than precipitated sulfur and considered actually to be the most active form, but it's just not that commonly found. And in the studies in dermatology for various skin conditions and skin concerns, for the most part, by and large, is precipitated sulfur that is used. But sulfur penetrates the skin readily. 2 hours after application, it can be found in the epidermis, and 8 hours after application, it subsequently trickles down in and can be found throughout the entire skin. However, at 24 hours after topical sulfur is applied, there is no longer any detectable sulfur in the skin, so it doesn't last. It's not long-lasting beyond that. There was some concern very, very, very early on that sulfur might actually be comedogenic. This came from very, very early comedogenesis studies on rabbit models. I have a whole video talking about pore clogging ingredients where I touch on the shortcomings of these rabbit models, so check that video out. But these rabbit assays had many limitations. After those initial concerning studies in the rabbit models came out, we now have a double-blinded, randomized controlled trial that has shown that sulfur topically is not comedogenic, and we have good acne studies using topical sulfur to affirm that. So it does not appear to be pore clogging or concerning for acne. So if you're reading that on any of these blogs or ranking sites, I would caution the interpretation of that. It is not comedogenic. As far as acne, we have studies showing that 5% sulfur lotion applied 1 to 2 times daily, depending on the study, can be helpful for decreasing the burden of inflammatory skin lesions, as well as improving oiliness or seborrhea, that output of oil in people with acne-prone skin. Sulfur is also very helpful in rosacea. We have sulfur studies showing that in rosacea patients, applying it 2 times a day for 8 weeks, that they have an improvement in their number of red bumps and overall disease severity. A 10% sulfur cream has been shown in studies to be as effective as oral antibiotics in some people with rosacea. And so, you know, it's a very useful rosacea treatment. I mentioned seborrheic dermatitis and conditions related to tinea versicolor. Most of those studies were done using a 2% sulfur shampoo in combination with a 2% salicylic acid shampoo, used daily for a week for seborrheic dermatitis on the scalp or dandruff, are used as a wash in the case of tinea versicolor. And that has been shown to be helpful in reducing the severity of disease. We don't have any studies of topical sulfur for perioral dermatitis, but clinical experience shows that it is an effective treatment and very well tolerated in people with perioral dermatitis. Perioral dermatitis, I have a whole video on perioral dermatitis, so if that's you, make sure you check that video out. But it is a skin disease we don't really have a great understanding about why it happens, and it can be very difficult to treat and very stubborn to treat. It's thought to be related to rosacea. That's not for certain, but that is a thought, is that it is in the family of diseases that are kind of similar to rosacea. So it makes sense that we see good results clinically using a topical sulfur lotion in patients with perioral dermatitis. What are the downsides of using topical sulfur? Well, actually, probably the worst thing about it is that it smells like eggs. Is that it smells foul. It has an odor to it related to the sulfur. If you've ever visited a sulfur spring, that's the smell of topical sulfur. That's probably the worst thing about it. It also can be drying and it can be a little bit irritating, but it is nowhere near as drying and irritating and difficult to tolerate as tretinoin or benzoyl peroxide or salicylic acid. It can safely be combined with those treatments without any problem. It just will increase the dryness you experience from those a little bit. A word of warning though, you do not want to apply topical sulfur to cuts, abraded skin, a wound, a sore. That can result in increased systemic absorption and potentially be dangerous. So you don't want to apply it on cuts or open sores or wounds, only to intact skin. Do not get it near your eyes or apply it around your eyes either. It is very irritating to the eyes, so keep it away from the eyes. As far as pregnancy and lactation or breastfeeding, believe it or not, it is the treatment of choice for scabies in pregnant women. Precipitated sulfur is the treatment of choice for scabies in pregnant and lactating women, as well as infants. Always discuss the safety of topicals with your treating healthcare provider, but do know that it is used in pregnant women, obviously, for the treatment of scabies. And another thing you may be concerned about is topical sulfur okay if you have a sulfa drug allergy? Sulfa allergy to medications in the sulfonamide class, that is not the same as sulfur. They are not the same, and sulfur is not the same problematic ingredient. So absolutely talk about this with your healthcare provider to make sure you're clear on the nature of your allergy. But medications in the sulfonamide class that people are frequently allergic to, like Bactrim, sulfa antibiotics, they are not the same as sulfur. There is another medication, however, that is applied topically to the skin, often in conjunction with sulfur, called sodium sulfacetamide. That is contraindicated if you have an allergy to sulfa antibiotics. That is contraindicated. Double check with your healthcare provider to make sure you're crystal clear though on the nature of your particular allergy and sensitivity. So yeah, that's how it works. Those are the conditions that it's helpful for, and it has very few adverse side effects, as I mentioned. The absorption of it hopefully helps you to understand that you really don't need to be reapplying it any more frequently than every 8 hours. It is still present in the skin. However, applying it fewer times than once a day is probably not going to get you as far because it is undetectable after 24 hours. So all that being said, what are some sulfur containing products that are good and that I would recommend to you guys? Topical sulfur does not have to be an expensive ingredient to pursue at all. In fact, it is pretty cheap. A product that I am a huge fan of, you can get it at Walmart here in the States. You can get it on iHerb. It is the Demodex sulfur ointment. This is a 10% sulfur ointment. Here, I'll just show you guys. It smells foul. It is a 10% sulfur. It is sulfur in a nice moisturizing vehicle. It goes on a nice monolayer. It doesn't sting. It's not as drying as sulfur can be. It's great for acne. It's helpful, very helpful for blackheads and for pores, and pretty easy for people with rosacea to tolerate this because it has so few ingredients. You definitely would want to do a test patch. It doesn't have any oils in it that would be contraindicated in seborrheic dermatitis. If you'll recall from my seborrheic dermatitis video, I mentioned that oils on the skin can contribute to flares of seborrhea, also flares of pityrosporum, malassezia, and what you guys call fungal acne. This doesn't have those oils in it. It's very no nonsense, very minimal, and it's only like $5. It's really inexpensive. Aside from the smell and it being a little drying, that's what's bad about it. I like this one, and there's also one that you can buy in Walgreens called ROSACEA. It is same thing, 10% sulfur. It is in a gel vehicle, very nice, very gentle, very affordable. That one is also great. Applied to the face daily. Is a very rational way to use this. It takes a while. It's not effective right away, but outwards of 12 weeks you start to see optimal effects, but it gives some good control fairly early into use. I would say after a few weeks of consistent use, you will definitely start to see some improvement. So that's a cheap product that I like a lot, cheap and effective. This is Precipitated Sulfur. The other one is ROSACEA. I'll list it down below for you guys in the description box. ROSACEA is also a 10% precipitated sulfur gel that is rosacea friendly, acne friendly, seborrheic derm friendly. And then a product that I have come to find on iHerb that I really like is this Earth Care sulfur mask. They have a 5% sulfur and a 10% sulfur mask, and it is really in a nice vehicle. It has colloidal oatmeal, which is moisturizing and soothing. It has shea butter in it. It also has sunflower oil in it. This also has kaolin and bentonite clay, so it can be helpful for mopping up greasiness and shininess. It can be left on the skin as a mask, or it can be left onto problematic areas as a mask. I would avoid this, however, if you have perioral dermatitis. I would stick to the more minimal ingredient one. But this mask, they make a 5% and a 10%, and both percentage strengths are effective. This one's going to be a little less drying and potentially take a little more time to exert efficacy, but is very good. One that's expensive, but I want to mention it, is the Eradicate by Kate Somerville Blemish Spot Treatment. It has sulfur in it. She doesn't disclose the percentage of sulfur. I assume it's precipitated sulfur. She doesn't disclose that. And it also has salicylic acid in it. So that product, the Eradicate, is going to be helpful for people with acne. People with acne and people with seborrheic dermatitis will do well with that product. However, that product has alcohol, isopropyl alcohol in it, It's liquidy, and it's intended to be drying. So it's very drying and can be more irritating and potentially tougher to tolerate than these guys. Eradicate, so Eradicate has salicylic acid in it. Again, salicylic acid, for those of you who aren't familiar, is a great treatment for acne and seborrheic dermatitis, but it can be problematic for people with rosacea. So the Eradicate's probably not going to be good for you for that reason, as well as the fact that two other rosacea unfriendly ingredients in Eradicate are alcohol. It has isopropyl alcohol, which is very drying, and it also has camphor, which can be a real bugaboo for people with rosacea. So Eradicate is great for acne and helpful for seborrheic dermatitis, helpful for fungal acne, but is not going to be good for rosacea. And I would stay away from it if you have perioral dermatitis as well. So that's that product. It's 22 pounds in the UK. That's pretty expensive, and it's a pretty small bottle. So you guys help me out. If you know of any other more affordably priced fragrance-free sulfur products, comment below on what they are. I would love to check them out. Dr. Dennis Gross has a 5% colloidal sulfur mask that is one of the few colloidal sulfur products that I have encountered. And you'll recall from the beginning of the video, colloidal sulfur is smaller than precipitated sulfur and thought to likely be more effective. So Dr. Dennis Gross's mask is pretty expensive, but potentially a little more effective than the 5% precipitated sulfur leave-on mask of the Earth's Care, and also contains licorice root, which is helpful for redness, anti-inflammatory, and it also contains retinol, which will be helpful for more keratolytic effect, peeling the skin a little bit, as well as helpful for blackheads, closed comedones, acne. Dr. Dennis Gross, though, because of the retinol, may not be easy for people with rosacea to tolerate. Peter Thomas Roth also has a 10% sulfur mask that is, as far as I can tell, precipitated sulfur. Unfortunately, that mask has fragrance in it and is pretty expensive. Many of you all use it and love it and swear by it. I understand why. 10% sulfur, that makes sense. I personally would not recommend it because of the fragrance, and the cost is pretty hard to keep up with. I think the ingredient-wise, as far as cost efficacy, the 10% sulfur acne treatment mask by Earth's Care is comparable, if not better, because it does not have fragrance. So that would be my recommendation over Peter Thomas Roth. So yeah, comment below on if you guys use a sulfur product and which one you use. There are many out there. I mean, there are tons here in the States. I'm just not as familiar with what is available in other countries in terms of over-the-counter sulfur. So help me out, and I would love to check that out for you guys. But I hope this video was helpful to you guys and giving you some baseline information on the utility of sulfur, what it's good for, how it works, and what you could expect from it. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.